would like to briefly highlight the immense value of art in ballet for emotional development and wisdom in children, and how this, being a form of positive psychiatry, can be used as a treatment modality for disorders of the nervous system such as autism spectrum disorders, for which we need to develop more effective treatment. Art, ballet included, is excellent for children because children are inherently creative. They are not so much constrained usually about the opinions of others as adults are, and so they're free to express themselves. And art is their natural form of expression. Children love to draw, love to sing, to dance, and to act by themselves or among themselves. And art develops empathy in children, the knowledge of themselves and the knowledge of the emotions of others. It also is very joyful, and it gives children a sense of control in situations where they can't do much. And in being so, it helps children develop emotionally and also physically. Ballet and dance are excellent movement, and also academically. And one of my favorite art forms is ballet, and I want to mention some more positive characteristics of ballet for young children, such as it is a form of moving meditation, and children rarely like to sit still, and studies also show that ballet helps people develop wisdom, even young people. And I have noticed, for example, when I dance my ballets in the morning, young girls, daughters of my neighbors and friends, which are 3 to 6 years old, even younger, there was one girl, 2 years old, they love to join me and to dance, even if they can't dance well. Or a friend's daughter, she made me a beautiful butterfly to express her affection for me. She always greets me. And so this is a natural way that children communicate through art, and it is good for adults, even though children inherently love art and are creative, to introduce them to different forms of art, such as painting and classical music in museums, and to instill in them the love of art. And for example, I have an amazing memory when I was a fellow in psychiatry. There was a 5-year-old boy with autism. He also had Prader-Willi syndrome, and I was his favorite person in the clinic for unknown to me reasons. I think my theory is that because I love art, I inherently connect easier to children through my creativity and love of art, and this is why children also love me. But I love children, and children pick up on your emotions and feelings. And this autistic boy really was so cordial when he saw me. Oh, hello Genevieve, how are you? Always smiling, wanting to hug me. And one day, I was not in the clinic yet. He arrived with his mom and asked my colleague, where is Genevieve? She's on the train to work. And so this little boy picked up a pen and drew a train and a girl and said, this is me. And so my idea is that it's excellent to use as therapy modalities which children will enjoy. And this is why ballet would be an amazing non-pharmacological treatment for autism spectrum disorders. Besides the emotional expression, ballet improves cognition through effects on the hippocampus, as studies show, and I was contemplating on what would be the mechanisms through which it might be beneficial for autism, because there are reports that ballet has helped a lot individuals with autism. I think that dance and movement involves the same brain regions that are affected in autism. Prefrontal cortex and basal ganglia and cerebellum and hippocampus and cingulate cortex. And by stimulating the neurons and the neural structures in these brain regions through movement and music, ballet is beneficial for the function of the neurons in other processes such as cognition, learning, and memory besides movement. But this we will understand in the future. And so I think that ballet would be excellent for non-pharmacological therapy for autism, for depression, and for anxiety in children and adolescents, because it's their natural activity which they enjoy. And I also think that it's a very social activity, and usually in children with autism, core symptom is a social communication deficit, as well as the repetitive and restricted behaviors. And so ballet would be able to influence both of these core symptoms in a very pleasant and close to the children way. And ballet is a form of positive psychiatry which was developed as a concept recently, starting from 2015, and it utilizes the positive traits and characteristics of an individual to focus on them instead of on the negative psychological traits, what is going wrong. In this way, through creating more happiness and well-being, positive psychiatry fosters resilience. And when children can move and they're happy, this will improve other areas of their life. And it will reduce stress, and it will give them more confidence, and it will be excellent both for the mind and the body. So, in summary, to say that art and ballet are good for adults and children, but especially children love art, and art and ballet would be great non-pharmacological treatments for children with different psychiatric and neurological non-pharmacological disorders. Of course, art therapy is already used, and it's good to use it even more because, for example, in autism and in depression and in anxiety in children, art therapy and ballet are just beginning to be explored. Thank you very much for your time and attention. I would greatly appreciate your comments.